Okay, so this Kahoot is going to be all HESI review covering everything that we've talked about in class from start to finish. As we're waiting for everybody to get logged in, if you guys don't mind double checking your cameras to make sure I can actually see your face and not just your ceiling. I will drop the password in the chat for people that need to join us later. Okay, let's go ahead and get started. Toddler with a Broviac catheter, so a central line where IV tubing becomes disconnected. So the very first thing we want to do is clamp the catheter. That way we don't have any blood that can backflow out of the catheter. We don't have anything that can get into the catheter, no air bubbles. So that's going to be our very first action. Perfect. Crying is going to stress that suture line on that cleft lip repair. So here we have a central line in a cancer patient with a fever. So we're going to take a blood culture of that line to see if it's the line that's causing the infection or if it's something else in the body. Hopefully it is not coming from the central line, and that way we can keep it. If the infection was coming from the central line, then we would have to pull that. So intussusception is where the bowel kind of slips into itself. So if an infant starts passing soft brown stool, that could be a sign that it spontaneously resolved. So if you remember, when they have an intussusception, they don't actually pass feces. You get mucus and blood in their stool, which gives you those current jelly stools. So this might mean that we can call off the procedure. So after 6 months, we're going to start with rice cereal, but then we can also graduate to pureed fruits and strained vegetables. Children with spina bifida are increased risk for a latex allergy. So you might see this out in the world with getting a rash with balloons. In the hospital setting, they might get a rash when they come into contact with our gloves. So most of our medical gloves have latex in them. So you have to be very careful to make sure that you have latex-free gloves when you care for a patient with spina bifida. So when we hold a child upright when we are feeding them, it decreases the chance of liquid pooling in their cheek and then dripping into their ear canal. So that would help to reduce the risk for them getting an ear infection. Our adolescent psychosocial development is going to focus on their sense of identity. So industry would be our school age children. So for kids with rheumatic fever during the acute phase, they can have joint pain and swelling. So we want to let them move around as much as we can to help alleviate some of that pain and swelling so they don't get stiff. So we will let them ambulate without restrictions. So when you have an adolescent that is very depressed, one of those red flags that you're going to watch out for is going to be that preoccupation about death. So that would be an indication that they're at increased risk for suicide. So the overwhelming sadness that doesn't go away is going to be what helps us confirm our diagnosis of depression. So we mix iron with vitamin C to help with the absorption. So that's why we give it with orange juice. Remember that milk does the exact opposite. So if we give iron with milk, it will decrease the body's ability to absorb the iron. So impetigo is one of those really contagious diseases that we have. We typically see those honey colored crusted lesions around the mouth with impetigo. Anytime you have a patient that can't speak, is blue, has poor breath sounds, we are going to prepare to assist their ventilation. So we know they're not oxygenating well, they're not breathing effectively. So our first priority is going to be preparing to ventilate them. So when we talked about development, we had two different types of developmental patterns. So proximodistal is where we learn how to do things in the center of our body, and then we work our way out. So we can do big arm and leg movements before we can do fine motor movements with our fingers. The other one is cephalocaudal, and that's going to be that head to toe progression. So we are 2 hours post-op from a cardiac cath in our right femoral artery. And what finding is going to indicate an obstruction? So if we went in through the right leg, like the right groin, if all of a sudden below that entry site is cool, pale, and blanched, it would mean that we don't have adequate circulation. So that would be your sign of an obstruction. A toddler in a spica cast is pretty much going to be casted from the waist down. So we need to find a toy that's not going to injure them, and also that they can express their creativity. So remember, toddlers like to be imaginative and creative when they're playing. So in this case, soft hand puppets is going to be our best choice. An infant with tetralogy of Fallot that suddenly turns blue is having a TET spell. So we want to put them in that knee chest position so that we can use the pressure of their abdominal cavity to help increase the blood that gets returned to the heart so that it can be oxygenated again. Child in DKA with Kussmaul respirations. So those are those really rapid sighing respirations. Is going to be exhibiting a compensatory mechanism for metabolic acidosis. So those Kussmaul respirations try and bring our pH up by blowing off all of our CO2. We know that one of the electrolytes that we lose when we have persistent vomiting is going to be potassium. So if we have a potassium that's on the lower end, then we definitely need to report that to the provider because there's going to be an increased risk of that dropping too low. Our kids with celiac disease are sensitive to wheat, oats, barley, and rye. So in this case, creamed corn is going to be the only option that's going to be available to them. So most of their diet is going to be fruits, vegetables, and meats. When we understand that something still exists, even though we can't see it, that is object permanence. Any sudden increase in a head circumference can be an indication of either increased intracranial pressure or hydrocephalus. So the next thing we want to do is palpate our fontanelles to make sure that they're not firm or bulging. Our patients with gastroesophageal reflux often have to have their formula thickened with cereal to make it heavier so it sits down in the stomach and it doesn't come up as easy. And then that also provides them with extra calories to help them to gain weight or at least maintain their weight. So remember, our toddlers are all about routines and having a structured environment. So implementing discipline is going to provide them that sense of security that they're looking for. Good job, guys. Hypospadia should be repaired before we start potty training. So we want to have that corrected before they start working on potty training. That way we don't delay it or interrupt the process. So the drink of choice for a child with sickle cell disease on a hot summer day is going to be lemonade. So if you remember, dehydration is one of the things that increases the sickling of their cells. So we want to make sure that we keep them nice and hydrated. So assessment findings for dehydration are going to be tachycardia, decreased blood pressure, and prolonged capillary refill. So our heart's going to be beating faster to try and pump what little volume we have around. And our blood pressure is going to go down because we're just not going to have as much volume. And then our body is going to be focused on perfusing our core and our essential organs. So we're not going to be as worried about perfusing our extremities. So we're going to get that prolonged capillary refill. We always need to be on the lookout for alternative methods of treatment, but especially when we notice any markings on a child, we need to confirm that it's not an alternative method of treatment like cupping before we suspect something like child abuse. So in this particular instance, this child has experienced cupping. Lyme disease is typically transmitted by an infected tick. So wearing long sleeves and long pants when hiking around a pond is a good way to keep them from attaching directly to your skin. When we're trying to prevent diaper rash, we want to make sure that we're using a barrier cream that doesn't have to be completely wiped off. With each diaper change, we want to just wipe away the top surface that's dirty and then leave the remaining there to protect the skin. When we're trying to evaluate effectiveness of thyroid therapy, we are going to be looking for growth patterns and developmental milestones. So if we don't have enough medication, then we're going to have slow growth and we're going to be missing those developmental milestones. So for a 5-month old, they should be able to turn from their belly to their back. They should also be able to coo at this point. So if they weren't doing those things, they might need a medication adjustment. In a child with congenital heart disease, if their pulse is getting slower, then we're obviously going to look at our other vital signs. So our oxygen saturation of 94 is normal. That's to be expected. Really good for a kid with a heart condition. Respiratory rate is normal for a 3-year-old. We've got good urine output. So the only outlier is our blood pressure of 70/40. So that's going to be trending towards widening pulse pressures, which is going to be an indication that they're not compensating well. When we're teaching about a lumbar puncture for a toddler, we are definitely going to want to teach parents about the positioning because we're probably going to need their help to get the child to cooperate. So when we're doing a lumbar puncture, we're going to lay the child on their side and kind of ball them up into that nice C position so that we can get into the space in between their vertebrae. The other way that we can do it is we can have them sitting upright and we can just bend them forward. We can get that same position that we would side lying. It just depends on what the child tolerates the best. So when we're providing reproductive counseling for parents with a son that was just diagnosed with Duchenne's muscular dystrophy, that is going to be an autosomal recessive disorder that only affects males. So if they would have another son, there would be a high probability of them also having Duchenne's. But if they would have a daughter, then she wouldn't be affected. Here we're looking at our BLS algorithm. So here we have an unresponsive child that has a pulse. So the next thing that we're going to do is give 2 breaths to make sure that the chest rises. If we didn't have a pulse, then we could start compressions. But because we have a pulse, we're going to focus on those respirations. Our 2-year-olds are doing that parallel play where they play next to somebody, but they both are doing their own thing. We have a diabetic with a blood sugar of 60 before bed, and the last time he ate was 4 hours earlier. So we know that our blood sugar is just going to continue to go down from here. So we want to make sure that we get a good bedtime snack with some sugar and some protein so we have a nice steady release of glucose to get us through the night. We have a patient with an NG tube that might throw up. We want to make sure that that NG tube is nice and patent. So we're going to go ahead and irrigate that. We want to make sure there's not something clogged at the end that might be making them feel like they want to throw up. In a child with complete renal failure, the byproducts of meat, so what gets broken down by the body, are really hard for them to excrete because they get excreted through their kidneys. So if they're in renal failure, then they're not going to be able to just excrete those byproducts. Koenig sign is going to be our indication of meningitis. Anytime we approach a family for organ donation, we want to involve the transplant coordinator. So that way they have one person that can see them through the entire process instead of having multiple people and not knowing who to go to ask questions. So here we're looking for those droplet precautions. So gown, glove, mask, eye goggles, or shield. A child with celiac disease is going to have that protuberant or really rounded abdomen, and then they're going to have that flattened, atrophied buttocks. Concave abdomen is going to be the exact opposite. So it's where it's going to be hollowed out. Guys, I need your cameras on or else I have to take you out of class. 3-month-old with a cleft lip repair, we want to use those soft elbow restraints so that they aren't touching their face. So when we're assessing our fontanelles on a 4-week-old infant, we're going to have the best luck if they're seated upright. That way we have good access to both the anterior and the posterior fontanelle. So to diagnose Crohn's disease, we're going to do a colonoscopy and biopsy. Egretol is one of our anti-seizure meds, and one of the side effects is going to be bone marrow suppression. So it's really important that we have weekly blood tests to make sure that we're not causing that. Any sudden change in weight when we have congestive heart failure should be reported right away to the provider. Typically, it's going to be a need for a medication adjustment. So sudden weight gain, we might have to go up on medication. If they had a sudden weight loss, then we might need to go down on our dose. Last one, guys. Anytime we have blue or pale nail beds below our cast, it means that we're not getting good circulation. So we definitely need to tell the provider about that. We want parents to encourage their child to wiggle their fingers so they get good circulation there. They can keep their arm elevated so they don't end up with swelling, and then Tylenol as needed for pain. Let's see who our winner is. It looks like Z is our winner tonight. Good job, guys.